Here's the kidney. Now there's one structure on this model that you didn't see on the other models, and that's this structure here. This is the adrenal gland. The adrenal gland. Now the adrenal gland does a lot of things, actually makes a lot of hormones, but so your stress response is going to be dictated by the release of cortisol here at the adrenal gland. This outer portion of the kidney is the renal capsule. The renal capsule. Here, from this outer view, I can see renal artery, renal vein, and the ureter. The ureter. So the outer portion, again, is the cortex, the renal cortex, where I have these structures, which are the renal pyramids. This is the renal medulla. And then here, this whole area is the renal pelvis. On this one, I can see the renal pyramids. The renal pyramids. I have space between the renal pyramids, which are the renal columns. They're real pronounced in this one. The renal pyramids are going to drain into the minor calyces. Minor calyces merge together, forming major calyces. And that's pretty much all you can see on this one. It's not a whole lot. So this is the respiratory system model. So this structure here is the tongue. This is the mandible. These would be lips, and this is the oral cavity here. This is the nasal cavity. These are the nasal concha. Okay, this is the inferior, middle, and superior nasal concha. Once I get to here at number 2, this is the beginning of the pharynx. The pharynx is the word for throat. Now the pharynx has 3 regions though, so this portion of the pharynx is called the nasopharynx. The nasopharynx. The portion of the pharynx that lies posterior to the oral cavity is the oropharynx. The oropharynx. This portion here, and here, all of this before we get to the trachea, this is called the larynx. The larynx. So for that reason, the portion of the pharynx here is called the laryngopharynx. The laryngopharynx. When you swallow, this structure here, called the epiglottis, is going to fold down and block off the airways. Okay, so that food is directed down into the esophagus here. This entire airway here is called the larynx. Here is where we have the vocal folds and the vocal cords are all here. And the area just around the vocal cords is often referred to as the glottis. It's called the glottis. I have some cartilage that is around the larynx. In front here, I've got the thyroid cartilage. Thyroid cartilage. Below the thyroid cartilage and here posteriorly, both of these are called cricoid cartilage. Cricoid cartilage. So air is going to move down the larynx and get into the trachea. So once I start to see these rings, at this point I'm at the trachea. Each of these rings are called the cartilaginous rings of the trachea. The cartilaginous rings of the trachea. Now the trachea is going to bifurcate or split into the right and left primary bronchi. Bronchi would be plural, bronchus is singular. Now, both of these are going to branch, but we have only the view of the right lung being opened. I do wanted to remind you that the right lung has 3 lobes. It's got the superior, middle, and inferior lobes, and the left lung's only going to have the superior lobe and inferior lobe. Here's the trachea. Trachea is going to branch off into the left primary bronchus and right primary bronchus. From the right primary bronchus, you can then see another split, and this gives rise to the secondary bronchi. The secondary bronchi. All right, the secondary bronchi are then going to split again to the tertiary bronchi and so on. So I'm going to continue to get more and more splits until I get down to the very fine airways, which we call the bronchioles. The bronchioles. The bronchioles continue to get smaller and smaller till we get to the smallest type of bronchiole, which is shown here. So this would be a terminal bronchiole. A terminal bronchiole. Terminal bronchioles are going to end in an alveolar duct, which we see one open up here. Okay, an alveolar duct, and the alveolar ducts are going to end at alveolar sacs. And alveolar sacs are where we are going to have exchange of gases between the blood and the respiratory system. In this, each one of these is a single alveolus or pulmonary alveolus. Even though they're only showing the capillary beds here, just know the capillary beds are on top of each of the pulmonary alveoli. These capillary beds are what is going to allow exchange of gases between the circulatory and respiratory systems. So this is a larynx model, but it also has some additional features of the digestive system on it. So let's just show you what you need to know for the practical exam. So this structure here is the tongue. Okay, this is the tongue. These are the teeth, and this is the mandible. The mandible. Now, one of the things that we have here is we can see 2 of the 3 salivary glands. Now, the third salivary gland is not shown here, and that is the parotid gland, which lies outside of the cheek. And you can see those on the torso models. I do see the other 2 salivary glands on here, though. This one is the submandibular gland, because it lies under the mandible. And this one lies under the tongue, so this is the sublingual gland. Sublingual gland. Another structure I'd like to point out is the hyoid. Okay, this is the hyoid bone here. The top of this structure here is the epiglottis. The epiglottis. This is that flap that is going to close the airways upon swallowing. This hole here that's kind of created when these 2 are together, this whole area is the glottis, and you might recall the glottis is where we've got our vocal cords, vocal folds, that sort of thing. We also can see the thyroid gland. The thyroid gland. All right, from the front view, starting here to where I start to get to the cartilaginous rings, this whole region is called the larynx. The larynx. The cartilage here is the thyroid cartilage. The thyroid cartilage. This here is cricoid cartilage. Cricoid cartilage. So this is cricoid cartilage, and in the back here is going to be cricoid cartilage as well. Once I get to this point, this is the trachea, and each one of these is a cartilaginous ring of the trachea. All right, so this is the tongue again. This here is the epiglottis. So I can see a lot more of the epiglottis here. Before I could just see this little point. This cavity here is called the glottis. The glottis. And I've got the vocal folds and vocal cords that are going to be here. This is thyroid cartilage. This is cricoid cartilage. And this is cricoid cartilage. From this level downward or inferiorly, I've got the trachea. And each one of these cartilaginous rings is a cartilaginous ring of the trachea. This model, there's a lot of different things that I could ask you on this model. So I'm going to start at the top and kind of work my way down. So this is the hyoid bone. The hyoid bone. From this structure here to here, this whole structure is called the larynx. The larynx. This gland is the thyroid gland that you see here. The thyroid gland. This is the thyroid cartilage. And this is cricoid cartilage. Once I get here, I'm at the trachea, and these in blue are the cartilaginous rings of the trachea. Here we have the hyoid bone, thyroid cartilage, cricoid cartilage, and here in the back, cricoid cartilage. This is the trachea and the cartilaginous rings of the trachea. The other side shows the thyroid gland. Posteriorly, I can see this top portion is the epiglottis. And the hole or cavity created here is the glottis. Opening the structure up, I can see the whole thing is the larynx up to here. This is the epiglottis. This is the vocal folds and vocal cords here. This is the thyroid cartilage. So this one you can see the thyroid cartilage, cricoid cartilage, and cricoid cartilage. And the other one, the cricoid cartilage here, was obscured by the gland. Okay, and then again, this whole area here is the glottis, and it has the vocal cords and vocal folds there. Here I can see a continuation of the trachea and the cartilaginous rings of the trachea. This is the heart. We can see the heart sits slightly off towards the left side. For this reason, the left lung is only going to have 2 lobes, whereas the right lung has 3. This would be the superior lobe of the left lung and the inferior lobe of the left lung. On the right lung, superior lobe of the right lung, the middle lobe of the right lung, and then here is the inferior lobe of the right lung. At the base of the lungs, you see this muscular tissue. This muscular tissue is the diaphragm, and it's the principal muscle for respiration. Here you can see a better view of the diaphragm. All right, removing the lungs exposes the heart. Underneath this structure here is going to be the right atrium. Under here is the right ventricle. Under here is the left atrium and the left ventricle. On the outside, this ear-like structure is going to be the right auricle, and similarly on the left, this is the left auricle. This vein here is going to take deoxygenated blood from the right arm. Okay, so this is the right subclavian vein. This is the right jugular vein. So the subclavian vein and jugular vein are going to merge together to form the right brachiocephalic vein. On the left side of the body, I'm going to have the left subclavian vein and the left jugular vein here. Those are going to merge together to form the left brachiocephalic vein. The right and left brachiocephalic veins are going to merge together to form the superior vena cava. The superior vena cava. Down here, I have the inferior vena cava. Also, if I were to just look at the heart itself, this is the inferior vena cava, and so is this. Deoxygenated blood from the lower portions of the body are going to enter the right atrium through the inferior vena cava. Deoxygenated blood from the upper portions of the body is going to enter the right atrium through the superior vena cava. The right atrium is here, and this is the tricuspid valve. The tricuspid valve. I have these strings that are attached to the valve, and these are called the chordae tendineae. Chordae tendineae. The chordae tendineae are attached to papillary muscles that ensure that the valve only opens in one direction and not the other. This chamber here is the right ventricle. The right ventricle. From the right ventricle, blood is going to exit the heart through the pulmonary semilunar valve here. The pulmonary semilunar valve. The pulmonary semilunar valve is going to go to the pulmonary trunk. The pulmonary trunk. Now, the pulmonary trunk is going to bifurcate or split, forming the right pulmonary artery and left pulmonary artery. Blood is going to become oxygenated and then return to the heart. How it returns to the heart is through these structures here. So these are the right pulmonary veins and left pulmonary veins. So both the right and left pulmonary veins are going to drain blood into the left atrium, which is here, the left atrium. From the left atrium, blood goes through the mitral valve or bicuspid valve. It's kind of dead here. Okay, the little strings are the chordae tendineae. So yeah, this is kind of broken, so sorry about that. So the strings are the chordae tendineae. They're attached to the papillary muscles. This chamber here is the left ventricle, From there, blood is going to travel through the aortic semilunar valve. The aortic semilunar valve allows blood to leave the heart and enter into the aorta. Just this portion of the aorta that's shown here is the ascending aorta, and I can see more of the ascending aorta here. If I look very closely, I can see there's two branches that are coming off of the aorta. This is the right coronary artery, and here is the left coronary artery. The coronary arteries are going to give blood supply to the heart itself. Now that I have the heart back together, we can continue to trace the right and left coronary arteries. Here is the right coronary artery continuing. The left coronary artery in this model splits immediately. So the left coronary artery is going to split, forming the anterior interventricular artery, which is here, and the circumflex artery, which is here. If I follow the circumflex artery around, I'm going to get to this very large vein here called the coronary sinus. The coronary sinus. This also gives you a better view of that inferior vena cava as well. For blood supply going to the body in the systemic circuit, that blood's going to go up into the ascending aorta and then arrive at the aortic arch. The aortic arch has three branches that are coming off of it superiorly. This first branch is the brachiocephalic trunk. The brachiocephalic trunk. The brachiocephalic trunk is going to bifurcate or split into the right subclavian artery and the right common carotid artery. The second branch is going to be the left common carotid artery, and I can see that continuing here. The third and final branch off of the aortic arch is the left subclavian artery. The left subclavian artery. Now, if I remove the heart, I can see some additional structures here. After the ascending aorta, we have the aortic arch. After the aortic arch, it's going to turn and the aorta is going to descend as the descending aorta. I want you to be more specific though. The portion of the descending aorta that goes through the thoracic cavity is going to be the thoracic aorta. So I can see the thoracic aorta here. Once the thoracic aorta goes through the diaphragm, which I see here, it's then going to be called the abdominal aorta. The abdominal aorta, and I can see part of that here. This structure here is the esophagus. The esophagus. The esophagus is also going to travel through the diaphragm and then connect with the stomach. I can now see more of the trachea exposed. So this is the trachea. The trachea is going to bifurcate. It actually bifurcates into the right and left primary bronchi, sometimes called the main bronchi, but I think primary is a little bit more used. So that would be primary bronchi here. And because I have 3 lobes in the right lung, I'm actually going to get 3 separate secondary bronchi. So, and then the secondary bronchi are going to branch to tertiary bronchi and so on and so forth, getting to the tiny bronchioles. Now the left lung only has 2 lobes, so for that reason, the primary bronchus is just going to split off into 2 secondary bronchi here. And then I can see more branching of the bronchi. Now I've got tertiary bronchi, etc., till I get to the small, fine bronchioles.